Good morning. I'm Don Fesko, Chief Executive Officer of Community Hospital here in Munster, Indiana. Here with me this morning is from the Center for Disease Control and Prevention, medical epidemiologist Dr. Daniel Feiken, Communications Director Dave Daigle, Indiana State Health Commissioner Dr. William Van Ness, Chief Medical Information Officer of Community Hospital Dr. Alan Kumar, and Indiana Governor Mike Pence. Each of my colleagues will be providing remarks, and then we will open the floor for Q&A afterwards. We ask that you please follow the hospital media policy while on site. We ask that you do not speak with employees, patients, or visitors here today. Please note this session is being recorded and is being streamed live. Here is some brief background on the situation that brings us here today. On Friday, May 2nd, the Centers for Disease Control and Prevention and the Indiana State Department of Health conducted a joint press briefing to announce the first confirmed case of Middle East respiratory syndrome coronavirus, also known as MERS-CoV, in the United States. The patient with the confirmed case is being treated here at Community Hospital in Munster, Indiana. The patient remains in good condition, and we are maintaining appropriate isolation protocols for the protection of patients and staff. Community Hospital recognized the possibility of the MERS-CoV infection and acted quickly to institute standard protocols to contain the standard and possible spread of the virus. The hospital has been working cooperatively with the CDC and ISDH regarding tracking of exposed healthcare workers. The MERS disease is believed to require close contact for transmission, and the patient's activities in the United States have been very limited. However, in an abundance of caution, the exposed family members and healthcare workers have been monitored daily to watch for the development of any signs or symptoms of MERS-CoV. I am happy to report that all exposed healthcare workers have tested negative for MERS-CoV. Community Hospital is a nationally recognized healthcare system for its health outcomes and remains a high-performing organization that is a safe place to receive care. I would now like to introduce from the Centers for Disease Control and Prevention, Dr. Daniel Feiken.
Thank you, Mr. Fesko. I am Dr. Daniel Feiken. I am a medical epidemiologist at the Centers for Disease Control and Prevention, and I am the leader of the CDC team who has been here since late last Friday, working with our partners in the state and local health department of Indiana and Community Hospital. Along with me on our team, we have another epidemiologist who's a specialist in travelers' health, and 3 epidemic intelligence service officers, better known as disease detectives, and a communications specialist. Our activities to date have focused on doing investigations of the close contacts of the patient, both here in the hospital and at the home, and to monitor them for illness. We've also provided guidance on the collection and testing of samples for MERS-CoV, and we've conducted investigations of travelers on the airline and the bus that the patient traveled on before he arrived here. As you just heard, fortunately to date, all the tests of the close contacts have been negative. However, because MERS is a relatively new virus and we're still learning much about it, we're being very vigilant to follow these contacts for out to 14 days after their last exposure and continue to do testing on them. I know there's a lot of concern here in the community about the health of people. What we can tell you about this virus mostly comes from the Arabian Peninsula, which is where its home is. And we know that it can spread person to person. However, this happens almost exclusively among very close contacts, either in the home or in the healthcare setting. There is no evidence to date for sustained transmission of this virus in a community. What CDC recommends is that travelers returning from the Arabian Peninsula who develop fever, cough, or other respiratory symptoms within 14 days of arrival report to their health care provider and mention the recent travel to the Arabian Peninsula. Although we didn't know where it would happen, we're not surprised that MERS-CoV has come to the United States. We know that infectious diseases do not respect international boundaries. In this day and age of global travel and trade, infectious diseases can spread almost anywhere. In preparation for this introduction, what CDC has been working on for over a year is educating the public about the MERS virus, educating healthcare workers, and working with state health departments to enhance surveillance for this virus and to train them in how to do the testing for this virus. We've also worked with people working at ports of entry to the United States to detect and report ill travelers from the affected region. So I want to conclude by commending the Department of Health and especially Community Hospital in their rapid and their efficient response to the first introduction of MERS virus in the United States. Thank you.
Thank you, Dr. Feiken. Now I'd like to introduce the Commissioner of the Indiana State Department of Health, Dr. William Van Ness.
Thank you, and hello everyone, and we appreciate you joining us for today's update. We are all very pleased to hear the patient is in good condition and is improving day by day. As a primary care physician of over 24 years in frontline practice, who admitted many people to my local hospital for respiratory infections of unknown cause, I know how challenging it can be to make that diagnosis and make it early. As a prior hospital CEO, I understand the challenge of preventing the spread of infection within a hospital to healthcare workers and other patients. Thus, I would like to personally thank Community Hospital in Munster for its outstanding efforts in recognizing this patient as high risk for MERS and for acting swiftly to help prevent the spread of this disease. Having the first case of MERS in the United States right here in Indiana is a scary situation. There's a lot of unknowns, as you'll find out, about this particular virus. As a physician, a father of 5 sons, and grandfather to 6, I understand the concerns and worries of Hoosiers and those here in Munster and other parts of Northwest Indiana. It is a little scary. We enjoy hearing the good news about the patient, but this is still a fluid situation. We will continue to provide you with new information as it becomes available. As Governor Pence says, Indiana is a state that works. To me, this shows that not only are we a state that works, but we work together. We collaborate. The collaboration between national, state, and federal has been outstanding, between CDC, all local health departments, the governor's office, Homeland Security. I want to assure Hoosiers that our medical experts, along with the CDC and hospital, are closely monitoring the situation. The state laboratory and the CDC laboratory have tested all samples for all healthcare workers at this hospital, as well as family members of the patients, and preliminary results are negative. Again, those that are in contact, obviously everyone at the hospital need to be tested. At this point, it appears that MERS picked the wrong hospital, the wrong state, and the wrong country to try to get a foothold. So, Dr. Kumar will now provide some additional information about precautionary measures.
Thank you, Dr. Van Ness. Next, I'd like to introduce Dr. Alan Kumar, Community Hospital's Chief Medical Information Officer. Dr. Kumar?
Good morning, everyone, and thanks for coming. I'm going to give a short timeline of the status of the patient and how things have gone since he has arrived. He came on the evening of April 28th and was admitted through the emergency department. He came into a private triage room and then into a private patient care room and was admitted up to a private patient bed on the general medical floor, all within about 3 hours. At no time during this stay were any other patients or visitors at risk because he was in a private setting the entire time. During his stay in the hospital, he was quickly detected by the infectious disease team here as being at risk. We worked with state and federal officials through the State Board of Health as well as through the CDC to send the appropriate samples, and when a positive diagnosis was made, appropriate precautions were taken. out of safety, because all information is not known about this disease, we made the decision to take all healthcare workers that had been exposed to this patient offline and put them on home isolation and just watch for possibility of symptoms for these people. They're being monitored every day. They're doing quite well, and people are in good spirits. Specifically about the patient, he has been improving every day, as was mentioned. He no longer has any oxygen requirements. He's in good spirits. He's eating well, and we have started the discharge planning process at this point. We expect him to be going home soon. As mentioned earlier, employee and family results have all been negative to this point. The incubation period can be anywhere from 2 to 14 days as far as we are aware, with most cases occurring within 5 days, and we believe that we have been able to contain the exposure at this point, but out of vigilance, we are going to continue to monitor the situation and make sure nothing happens further. Thank you.
Thank you, Dr. Kumar. Finally, I'd like to introduce and thank him for coming up, Indiana Governor Mike Pence.
Thank you all for being here, and I want to thank Don Fesko and Dr. Kumar here at Munster Community Hospital. I want to thank Dr. Bill Van Ness, the Indiana State Department of Health, and Dr. Daniel Feiken with the Centers for Disease Control and Prevention for your comments and for your efforts over the last several days. Also, am informed that we're also joined somewhere by Senator Joe Donnelly, and the support of our federal delegation in Washington, D.C. has also been appreciated and received with gratitude. Here in Indiana, health comes first. We have no higher priority than the health and well-being of our people. From the first time that our administration was alerted to the possibility that the first U.S. case of the MERS virus had appeared in Indiana, we deployed the full resources of the Indiana State Department of Health to diagnose this case and to work to prevent the spread of the virus. We are personally relieved and thankful that the patient who contracted this virus is improving and may well be going home soon. We will continue to keep the patient and all of those who may have come into contact in our prayers. Hoosiers will be glad to know that the collaboration between local, state, and federal health officials in this matter, in my judgment, has been exceptional. And I believe it's played a key role in the efficient and effective response that you hear reported today. But none deserve more credit than the outstanding physicians and staff here at Munster Community Hospital. And I invite you to give them a round of applause. Munster Community Hospital's swift diagnosis, careful precautions, I believe, contributed mightily to our public health, and I believe the efforts by the administration, by the physicians, and by the staff here at Munster Community Hospital have made every Hoosier proud. I also wish to commend our team at the Indiana State Department of Health, our Commissioner, Dr. Van Ness, and their team for their outstanding efforts in testing and in coming alongside the efforts here at Munster Community Hospital, and our federal partners at the Centers for Disease Control have our deepest thanks for their immediate and thorough and global expertise brought to bear on this matter. We are encouraged, to say the least, we are encouraged by the results of testing to date, but Hoosiers may be assured until we are confident that our citizens are beyond the reach of this virus, we will continue to exercise an abundance of caution. We will remain vigilant. We will continue to monitor all those that have come into close contact with this patient, and testing will be repeated. But because of the efforts, first and foremost, of the leadership here at Munster Community Hospital, I am confident that we are well along the way to containing and securing this virus from any further spread in our state. And on behalf of the people of Indiana, I am grateful to all of those who acted so swiftly and so decisively to bring that about.
Thank you very much, Governor Pence. If Dave can come to the podium, and we will start the Q&A session.
Hi, thanks very much. For a couple of rules, we don't have a microphone out there, so what I'll do is I'll ask you to say your name and the outlet, and I'll repeat your question up here, and we'll triage it. And if we could hold it to one follow-up, because there's quite a few of you folks, and we can circle around if we have to. So I'll start with the young lady next.
ABC, Chicago. I think this is a question for the CDC. Can you talk a little bit more about the investigation into people who were on the airline and that bus? What do you mean by that?
So it's Leah Hope, ABC, and more information about the airline and the bus for Dr. Feiken.
So CDC has obtained the manifest of the travelers on the airplane and is working with health departments around the country to contact these travelers and make sure they're not sick, and if they are sick, to get them tested. So far, almost 3/4 of the travelers have been contacted, and to date, none of them have been symptomatic. We're also working with the states on contacting bus passengers as well.
So about how many people was that total?
The airline had about 100 people, and the bus, there were about 10 passengers.
Thank you, Leah. Right here in the front row, please.
Veronica Carter, WBBM. The people, the fatalities from this, are they elderly, children, people who aren't seeking medical care?
So the question is about the fatalities thus far in MERS, and I think that's for you, Dr. Feiken.
Okay. So what we know, as of last Friday, there have been 261 reported cases of MERS in the world that have been confirmed by WHO. There's over 100 more reported cases not yet confirmed. The overall mortality rate is about 30% or a third. However, we do know that most of the mortality has been among elderly patients and those with underlying conditions. So it does appear that there is increased fatality rates among those who are elderly and have underlying conditions.
Thank you. Next question. Yes, ma'am.
Tanya Francisco, WGN-TV. Can you tell us a little bit more about the actual patient? We know that he is a healthcare worker. Can you give us an age? What specific? Is he a doctor? Is he a nurse? What was he doing in Saudi Arabia? Tell us a little bit more about
So the question is for more information about the patient, and I think that's you, Dr. Kumar.
Good morning, thank you. Due to federal privacy regulations and concern for the patient's well-being, no further information is being released beyond the patient is a healthcare worker and he was working in Saudi Arabia before returning to the United States.
How about an age?
We're not releasing any further information.
Yes, sir, right here.
I'm Mike Quinty with WCEZ. What's going to be the protocol once he's released? How soon is he going to be released? Is he going to be confined to his house? Or is he going to be able to interact with the public? And how is the public going to be reassured that everything's safe?
So the question is about the patient and the future of the patient being released, whether they go home and the interaction with the public. And Dr. Kumar, I think that's you as well.
Great question. We are working closely with the CDC in the discharge planning. We expect home isolation, and the patient seems to understand that very well, but all the details of that have not been worked out to this point. We expect him to be going home soon. Exactly when, we haven't completely nailed down at this point.
Thank you. Yes, ma'am, right here.
Dorothy Tucker, WBBM. If I'm a user, I'm wondering, when he came back to this community, did he by chance go to the drugstore? Did he go to the grocery store? Is it possible that he was out in the community before coming here to the hospital?
Yes, ma'am. Thank you. So the question is about the patient and whether the patient was out in the community, what the actions and what we might have about where the patient went before he went to the hospital. And Dr. Feiken, do you want to take that one?
Sure. We do know that he had limited exposure to the community. Once he arrived, he went directly to his family's house. As I have mentioned, there's no evidence that this virus spreads within the community. It's really among close contacts at home in healthcare settings who actually have direct contact with the patient. So there's no evidence that there's risk on sort of casual contact, walking by somebody in the community.
So follow-up question then.
Yes, ma'am.
Is his family isolated?
Is his family isolated?
Family members.
And Dr. Kumar or Dr. Feiken? Dr. Kumar.
The family has been put on home isolation, and if they are to leave the house, they are to wear a mask is the recommendation. That applies to our healthcare workers as well, who are exposed to the patient.
Thank you. Next question. Yes, ma'am.
Teresa Schultz with the Post-Tribune. You said that the community was able to recognize the symptoms fairly quickly. How quickly, and what enabled you to recognize it quickly? Was it the training in MERS and knowing what questions to ask?
Thank you. So the question is about recognizing the symptoms and how were you able to recognize them very quickly? And I think that's you, Dr. Kumar.
We have an exceptional medical staff and healthcare workers here at the hospital. It's all about asking the right questions and spending time with the patient. The quality and the care we provide at this hospital is our first expectation and our top goal. And he was recognized as having an illness. He was admitted to the hospital. The next morning, the infectious disease service was asked to consult on the patient, and they are the ones that determined that this patient was at risk for this disease, and they're the ones that then worked with the CDC and the State Board of Health to send the appropriate confirmatory testing.
Thank you. Next question, please. Yes, ma'am.
Elizabeth Brackett, in the WTTW in Chicago. I'm wondering if you can tell us if the patient, you say he was a healthcare worker, if he was working with anyone that had the MERS virus in Saudi Arabia. Is that?
Yes, ma'am. So the question is, this was a healthcare worker, and were they working with MERS patients in the hospital in Saudi Arabia? Dr. Feiken, is that you?
Yes. So he was working in a hospital in Saudi Arabia. He does not recall directly working with patients who had MERS, although he worked in a hospital that did have cases of MERS.
Thank you. Next question, please. Yes, ma'am.
If this were a disease that spread in the community, we would see a big problem at this point, right?
So the question is, if this does spread readily in the community, we would have a major problem. Dr. Feiken?
So, yes, most likely, if this were a disease that were highly transmissible, something like the measles virus, once it gets into a community, it would spread, we would know about it. So the fact that we've only seen cases among close contacts does reassure us at this point that the spread really is confined to those who have close contact with an ill patient.
All right, I'm going to check to see if we have a question from the web. Do you?
We do.
Okay.
Yeah, questions from online. How many staff members had contact prior to being placed on home isolation? How many healthcare workers at community hospital were tested?
So the questions from the web is, how many staff members had contact and how many staff members were confined to, is it confined to the home?
In isolation, and how many were tested?
Dr. Kumar, I think that's you, sir.
Good morning, thank you. We had about 50 patients that had contact with the patient before full protection. 50 employees that had contact with the patient prior to full protective isolation being put into place. Every person that had contact with the index patient has been tested, and they have all tested negative.
Thank you. Do we have anything else from the web?
Yes. When, on what day was the patient placed in isolation? And you said the healthcare workers tested negative. Does that completely rule out the possibility of infection?
So the question is, when was the patient put in isolation? And by the testing of all the healthcare workers, have we ruled out further transmission? Dr. Kumar?
The patient was always in a private room during his entire stay from the emergency department through his inpatient stay on a medical unit. He was placed in isolation the next day. And even though the initial testing for everyone is negative, and that is quite reassuring, the incubation period for this virus is known to occur out to 14 days, although that is rare. And we expect, in concert with the CDC and the State Board of Health, we will do repeat testing at the end of that time period to confirm they are all still negative.
Mm-hmm. All right, thank you. Yes, ma'am, in the room.
Just a quick question about when the patient came in. Did he come in on his own accord? Did he walk in? Was he washing? Was he burning? I'm just wondering, why is it that he was able not to sit in the waiting room and go directly?
Right, so the question is about how the actual patient presented at the hospital. Dr. Kumar?
He did come in on his own accord with his family when he was not feeling well. We pride ourselves on efficiency as to why he did not sit in our waiting room. You can't ever account for surges in an emergency department, but we hope for the best for every patient.
Because people knew him here?
No.
Yes, back row, please.
Is there a concern that this MERS virus may, I guess, mutate or change and become more, you know what I'm saying?
Yeah, so the question is there a chance that the MERS virus might mutate or change and become more transmissible or more dangerous? And I would think that's you, Dr. Feiken.
That's a good question. There is a possibility that viruses can mutate, change over time, become more transmissible person to person. To date, there's no evidence with this virus that we've seen from genetic sequencing virus from the Arabian Peninsula that it has changed.
Thank you. Yes, sir.
When he came in, knowing that he's a healthcare worker and where he was coming from, did he suspect he may have had MERS, and did he suggest perhaps testing for it?
Thank you. So the question is, does the patient suspect that he had MERS when he came in? And Dr. Kumar, that may be you?
The family was part of the interview process that led to the diagnosis, yes.
Thank you, sir. Yes, Rick, back here.
Can you describe what isolation actually means when the patient is in isolation here in the hospital?
Yes, so we want to know what isolation actually means, Dr. Kumar.
There is different types of isolation. Good question. For this patient specifically, for this type of virus, it required both respiratory and contact isolation. And for healthcare workers interacting with a patient, that would include a mask, gloves, gown, and eye protection.
Thank you. Yes, ma'am.
How does MERS relate to SARS virus? And also, what is the test that people are given?
The question is, how does MERS relate to SARS, and what is the test one would give? And I think that's you, Dr. Feiken.
Okay. So both MERS and SARS belong to a group of viruses called coronaviruses. They're similar but not identical. They mainly cause a respiratory illness. As you know, SARS emerged in the year 2003, had an origin in the Far East in China. MERS, we think, probably emerged in 2011, though the first cases were picked up in the Arabian Peninsula in 2012. And they both belong to the coronavirus group. The testing. So quickly, the testing. The main way to detect this virus is to do a test either on the in the nose or on the blood, and look for the molecular signature of this virus. You can also check the blood for antibodies to the virus, but that takes about 14 days after the exposure to develop those antibodies.
Thank you. Yes, ma'am.
Just so the public will know, when he came in, you've given a general idea of what the symptoms were, but how exactly was he acting, breathing, walking, fever? How did he look? How did he act?
Okay, so this is more details on how the patient presented to the hospital, and Dr. Kumar, that's you?
Generally, when you present with the MERS virus, it is similar to flu-like symptoms. You will have fever, cough, shortness of breath. And that is classically the presentation that you will see. There have been cases in Saudi Arabia where patients have had some diarrhea as well, although that's rare. Most of the severe cases in Saudi Arabia, in the Arabian Peninsula, have had other comorbidities and other illnesses, and they have been more elderly. This patient was in good spirits throughout. He was never admitted to an intensive care service or a telemetry service. He was never on a ventilator. He did require some oxygen during his initial part of his stay, but he is now back on room air with a good appetite and doing well.
So he had to say something fairly quickly that he had been in Saudi Arabia for him to make this diagnosis.
So this is the travel history to Saudi Arabia.
The travel history is part of the history that led to the diagnosis, yes.
Thank you. And we have something from the web, please.
Dr. Feiken said there's been no sustained chain of transmission with this virus. Does it mean it has never gone from person to person, or what is the longest chain of transmission to date?
So this is about the transmission, and what if there is transmission close? How long would that take?
So just to clarify, it has gone person to person, but that person to person is only among close contacts. So among healthcare workers caring for the patient or family members, there's no evidence that it's gone beyond that to a third or fourth generation in the community. So it still is really confined to those who have close contact with an ill patient.
Yes, ma'am.
Can you give us a definition of close contact? Is touching someone close contact? Is sneezing someone?
So the question is, what is close contact? And Dr. Feiken, do you want to take that?
Yeah, close contact, what we define usually as caring for a patient. So more than just a single incidental interaction. It's actually caring for them, touching them, perhaps coming in contact with their respiratory droplets. That's what we suspect is the main way of transmitting it, is contact with respiratory droplets that have the virus. So it's really sustained care or physical contact with a patient.
So if I broke it down, respiratory droplets mean if I sneezed on you, or if my nose was running and some of the fluid from my nose actually touched the person, just so the people at home understand.
Yeah, that would be a risk factor, is coming in contact with a sneeze or a cough, droplets from somebody's mouth.
Thank you. Another from the web, or?
Yes. Is CDC generating sequence data from the case, and when will a genetic sequence be available?
So this is about sequence data and the genetic sequence, and Dr. Feiken, that's for you, sir.
I'll have to defer that question. I'm not sure. There are specimens at the CDC from this patient, and I'm not sure of all the molecular work that will be done on this.
Thank you. Yes, sir, ma'am.
I have a question from Twitter, someone asking which hospital in Saudi Arabia.
So from Twitter, the question is which hospital in Saudi Arabia, and Dr. Feiken, do you want to answer that?
I don't think we're releasing the name of the hospital.
Thank you.
What city?
It's in Riyadh.
Yes, ma'am.
How long was the patient in Saudi Arabia?
So the question is, how long was the patient in Saudi Arabia? Dr. Feiken, I think.
The patient lives in Saudi Arabia.
Oh, I thought we were told he lived here.
No, he has family here.
So,
Is he an American
but
citizen?
he works at this hospital and lives in Saudi Arabia, has family here.
So this is more information about the patient and residence?
He works in Saudi Arabia in a hospital.
Is he a Saudi national?
We can't release.
Yeah, I don't think we're providing additional information or more details on the patient right now.
So he doesn't work at this hospital?
This hospital?
I
No.
mean,
Okay,
to help you.
So the question was, does he work at this?
Saudi Arabia, or does he live here? Is he back and forth? I mean, we just want to clarify that.
So the patient, does he live in Saudi Arabia? Does he travel back
He
and
lives in
forth?
Saudi Arabia.
Okay.
And
Patient.
was he coming home for a visit? Was it an unplanned visit? Did he come home
Dr.
for a
Feiken, was he
visit?
coming home for a visit?
It was a planned visit.
A planned visit back here. A question from the web. Oh, we're good on the web. Questions in the room? Yes, ma'am.
I know we need to be careful about the patient confidentiality, but you've mentioned that the high-risk patients are older. Would it be fair to say that this patient is not in that high-risk category of elderly patients?
So the question is the patient in a high-risk category of perhaps age? Dr. Kumar.
I don't want to give any specifics about the patient in terms of his medical history, but I will say that he is improving rapidly. He is on room air. He is eating well. And he's walking around and doing quite well.
Yes, sir.
So when you say he's going to be then released, does that mean he's going to be released bus to a plane back to Saudi Arabia, or is he going to stay in North America?
So the question is, if the patient is to be released, what are the next actions? Dr. Kumar.
That's a great question. We are still in the process of working that out with the CDC to make sure that when he does choose to travel back to Saudi Arabia, that he will be safe to do so, and that has not been determined at this point.
Thank you. Yes, ma'am.
Were there any restrictions on him? Say he just decides he wants to go home. Is there any kind of protection for the public?
So the question is, when the patient departs the hospital, will there be protections in place for the public?
Good question. At this point, the patient has been absolutely cooperative with all questions, all plans, and I don't expect that to be the case. However, again, some of these details are still being worked out in terms of when he is safe to go beyond home isolation.
So when this patient...
Oh, I'm sorry.
when
Let
this
me go right back here and we'll come back to you, ma'am. Yes,
When
ma'am.
this patient arrived in the United States and came through immigration, you said that CDC has a program that is checking to make sure that people are healthy when they come in, particularly from an area like Saudi Arabia, where the MERS virus has been seen. Was he checked when he came through customs?
So this
and
is
where did he come through customs?
All right, so this is a question about the ports of entry and where he came into the country, and was he checked? Dr. Feiken?
Well, he arrived in Chicago. However, he was not. He did not self-identify as somebody who was ill at the time. As we heard, his respiratory symptoms developed actually after his arrival. So he would have not been a suspect person at the time of his arrival.
Thank you. I'm sorry, you had a question,
Are
ma'am.
there now restrictions on people perhaps who are traveling from Saudi Arabia to America? What is now in
All right.
place?
Excellent. Questions is about travel restrictions between the U.S. and Saudi Arabia. Dr. Feiken?
There are no restrictions on travel to Saudi Arabia or from Saudi Arabia. There's no active screening. Although we do have an active program of education at ports of entry. The CDC has 20 quarantine stations at ports of entry into the U.S. and have guidance for airline staff or quarantine officers to identify ill travelers and report them when they arrive.
Has this case the federal agencies to reevaluate that current policy?
So the question is, are we looking at the travel restrictions or the port of entry policy based on this case? Dr. Feiken?
Not to my knowledge. There are no changes to the guidelines. I should mention there have been exported cases from the Arabian Peninsula of this virus, but there only have been a handful to some countries in Europe and Asia, but fewer than 10 exported cases the whole time.
Next question, please.
Do you expect to see more MERS cases in the United States?
Thank you. That's a great question. So the question is, will we see or do we expect to see more MERS cases in the United States? Dr. Feiken?
Well, obviously we can't predict what we'll see. I would say if this virus continues to infect people in the Middle East, it would not be surprising that we would have another importation at some point somewhere.
All right, yes, ma'am.
You know, if someone comes back who was traveling in the Middle East and comes to the country, and they do present flu-like symptoms, what would you suggest they do? Should they go to the ER like this patient did?
So the question is, if you have a travel history to Saudi Arabia and flu-like symptoms, what would be your next actions? Dr. Feiken?
Well, if you know you've been to the Arabian Peninsula and you have symptoms, it will probably be best first to call your healthcare provider, let them know the situation so that they can arrange to bring you in and get you tested in a way that wouldn't expose anyone else. Obviously, if somebody is feeling very sick and they need to go to the emergency department, they should do so, and as soon as possible identify themselves as somebody returning from the Arabian Peninsula, and they could even mention MERS so that the hospital staff knows to act quickly.
Thank you. Yes, ma'am.
I spoke with our health officer in St. Joseph County, Indiana, on my way here today, and he said that he was told in a conference call on Friday that the incubation period is 5 days, but I know what you're telling us is now 14 days. Am I misunderstanding that, misinterpreting that? What is the actual incubation
Thank
period?
you. So the incubation the incubation period, is it 5 days or 14 days? You want to take that, Dr. Kumar?
I'm happy to. The incubation time frame has been seen as little as 2 days, and although rare, as far as 14 days. But the vast majority are within 5 days.
Thank you. Question from the room. Yes, sir.
How closely will the federal government be monitoring this with not only the hospital, but the town of Munster, the county of Lake County? This is Northwest Indiana, so there's not a lot of experience in dealing with it.
So that's a great question. How closely will the federal agency, the CDC, I guess, monitor this with Indiana? Dr. Feiken?
Well, we're here together with you until we have this situation under control. So we're here as long as we need to be.
The collaboration up to this point between the hospital, the county, Illinois Board of Health, Indiana State Board of Health, and the CDC has been wonderful and has made it easier to contain the situation at this point because of the collaboration between all the relevant parties.
So we have time for two more questions.
I want to comment. I was saying the State Department of Health has committed all resources with the support of the governor, so we are not going to let this go until we know it's over. So we are very committed to stand right on top of this, and there's, as mentioned, great collaboration with all county health departments and so forth. So we're here till it's done.
So we have time for a couple more questions, and I think after that, some of the principals will be available for additional interviews. Second to last question, perhaps. Well, maybe not. All right. Well, I think we're done here. Thank you, everybody, for coming out.
Thank you for answering the question.
Extraordinary people, extraordinary care.